questions
Yeah.
related to
Oh,
Medicare out there. But I am delighted to have two panel members with us today, Michelle Thomas and Don Oellerich. Did I pronounce it right, Don?
Oellerich.
Oellerich. Okay.
Rich.
Um, who are going to share with us some important insights on what we need to know about Medicare. And so that we don't, so we can jump right into this, I am going to exit stage left and I'm going to turn over the platform to you. And we had a little huddle ahead of time where we're going to, folks, you can type in your questions at any point during this discussion, but we're going to kind of leave the open forum to the end because there's so much content that Don and Michelle have to share with us. So I'm going to exit stage left here. I'm going to turn it over to the two of you, but folks, use chat and Q&A, and um, I will see you at the conclusion here.
Thank you
Okay.
so much, Steve. I appreciate it. And we always enjoy being with you another year on a different topic. But good morning, everyone. And thank you so much for joining us today on what retirees should know about Medicare. My name is Michelle Thomas, and I serve as the program lead for Arlington's VICAP program. So I, along with my colleague Don here, who is also a certified Medicare counselor, are going to provide key tips to help you make informed healthcare decisions. So while we work in Virginia, we represent one of 54 state health insurance and assistance programs across the country. All programs deliver services either by their state units on aging or through their local agency on aging. So we'll continue to provide the contact number in website for SHIP so that you can find the program in your area. But all programs have counselors who provide free, unbiased, confidential counseling to Medicare beneficiaries, their caregivers, neighbors, and care partners. We are not licensed to sell insurance. So with that, Don, I'll pass the baton over to you. Thank you.
Hey. Well, thank you. Thank you. Welcome, everybody. It's a pleasure. So in this session, we're going to provide an overview of Medicare, explain eligibility requirements, enrollment periods, and cost, discuss some options for employees and retirees, and discuss a little bit about how Medicare and job-based and retiree coverage work together. As Michelle mentioned, the state health insurance program is there for provide free, unbiased help. I encourage you to reach out to them in your local area. So what is Medicare? Medicare is health insurance for individuals 65 and over, certain individuals under 65 who have disabilities, and persons any age with end-stage renal disease. It's administered by the Centers for Medicare and Medicare Services at the federal level. Medicare is the largest health insurance program in the nation. It currently covers over 68 million lives and expends over $950 billion in payments every year. Okay. Medicare was designed for seniors and provides comprehensive medical coverage. But as we will discuss later, it does not cover everything, and it doesn't pay 100% of medical expenses. Um, hmm, how do I get the slide to change? Sorry. Oh, okay. So Medicare has four parts. It has Part A, which is medical insurance, Part B, Part A, which is hospital insurance, Part B, which is medical insurance, Part D, which is the prescription drug plan, and Part C, which is Medicare Advantage plans, which are managed care plans, which include Part A, B, and usually D. Okay. When Medicare was developed back in the 1960s, the model for health insurance was hospital insurance and major medical, and then doctor insurance. And that's why we have this A and B thing left over from that period. So let's get into the basics here. The hospital insurance, what does it cover? Well, of course, it covers inpatient hospital insurance, hospital care, skilled nursing care, home health care, and hospice care. Part A is premium free for most people. That is, those who have paid payroll taxes for 40 quarters or 10 years will not have to pay a premium for hospital insurance. If you do not meet the 10-year work requirement or the 40 quarters of work, the premium can be quite steep, as much as $518 a month just for your Part A coverage. So it's something to be careful about when you're thinking about signing up for Medicare if you're covered by the 40 quarters of work, so you have free health insurance, or if you have less than that, what you might have to pay. So in addition to being premium free, there are co-payments and deductibles with hospital insurance. So if you're in the hospital, if you're admitted into the hospital, basically on day one, you pay a $1,676 deductible. Okay, so when you're admitted. If you're in long-term, 61 days to 90 days, you pay out of pocket $419 a day. And if you're in for a very extended period of time, you pay $838 a day. And after 150 days in the hospital, you pay all costs. Okay. Now, I'm going to go back to this for a minute. This says for each benefit period, and I think this is important when you're thinking about this deductible. If you go into the hospital and you're admitted for a knee replacement, and you're in the hospital for 3 or 4 days, you pay $1,676. If in the same year you would have some kind of a catastrophic event, let's say you have a heart attack, and you're admitted to the hospital again, you have to pay that deductible again, okay? Because it's a different benefit period. It's a different thing that you're going into the hospital for. So it's really important to realize that this deductible can add up over time within a year. Part A covers skilled nursing care. We'll refer to as SNF care. And with SNF care, you get a semi-private room, you get your meals, you get skilled nursing and rehab services. In order to be covered under Part A SNF care, you must meet certain conditions. You must be in the hospital as an inpatient for 3 consecutive days or longer. And the SNF care must be for the hospital-treated condition. And your provider of the SNF care must be participating in Medicare. And you're going to hear that a lot about Medicare services, that Medicare only covers services for Medicare participating providers, whether it's a doctor, a hospital, a SNF center, a place that provides wheelchairs. It's very important that you have a provider that's Medicare participating. Okay. What do you pay if you wind up going into skilled nursing care? If days 1 to 20, you pay nothing. Okay, it's free. Medicare covers 100% of the cost. If you're there longer, 21 to 100 days, you have to pay out of pocket $209.50 a day. After 100 days, you pay all the costs. Okay, SNF care is generally not meant to be long-term, so it's unlikely that anybody would be in for 100 days or more. But the average stay for a knee replacement for Medicare patients is about 24 days, although it varies. But 24 days means that you're paying $209.50 a day for 4 days of care. Okay, home health care covers medically necessary part-time and intermittent skilled nursing care. It covers physical therapy, speech therapy, pathology services, and occupational therapy. Okay. In order to be eligible for home care, you must be homebound, which means that you're normally unable to leave the home, or leaving the home is a major effort. If you can go to the grocery store by yourself, you're not considered homebound and you won't be eligible for home health care. Okay. You must need skilled care on a temporary basis. And again, the home health agency providing care must be Medicare approved. I've had people that I've counseled in the past who have used a home health agency that wasn't Medicare approved, and they had to pay the whole bill themselves, which equaled thousands of dollars in the end. Okay. So paying for home health care is fully covered by Medicare. Okay. In original Medicare, you do not pay for covered home health care services. If you need a walker, a wheelchair, a hospital bed, a cane, oxygen equipment, that's considered durable medical equipment, and that's covered under a different part of Medicare, and you have to pay 20% of the approved amount for that. The final thing that Medicare Part A covers is hospice care. This is special care for the terminally ill, which is a special way of caring for people who are terminally ill and their families. Hospice care is meant to help you make the most of the last months of your life. It's about care, comfort, and pain relief, not cure. Okay. Again, your hospice provider must be Medicare approved. There is no cost for hospice care. You're eligible for hospice care if your doctor certifies that you have 6 months or less to live. Now, this can be repeated several times if necessary. So if you were in hospice care for 6 months and you looked like it was going to be another 6 months before you passed, the doctor could recertify you and you could continue with free hospice care. Okay, that's for Medicare Part A. Medicare Part B is your medical insurance. This covers your physician services, durable medical equipment, as I mentioned. It also covers some home health care, outpatient care, mental health services, and many preventative services, including a welcome to Medicare physical and yearly wellness visits. Part B requires a monthly premium payment of $185 a month. And for higher income individuals, there's an additional amount known as the income-related monthly adjusted amount. And I'll talk about that more later. So Medicare Part B covers over 2 dozen preventative services, including vaccine shots such as the COVID shot, the flu shot, Hep B, and pneumonia. But Part B doesn't cover shingles. That's covered under Part D, which is the drug plan. It also covers many standard cancer screenings for both males and females. I include in the resource section of the slide deck a picture of a Medicare publication on preventative services. And it's very important that you take a look at this in terms of the availability of the services, how frequently it can be had, and how much it might cost. So I had a recent person who called me because they received the bill for their cholesterol testing. And it turns out that preventative services only covers cholesterol testing every 5 years. Now, I get my cholesterol tested every year, as most people do. So it came as kind of a shock that he had to pay for it out of pocket. Okay. So I mentioned that the standard Part B premium is $185 a month, but if you have higher income, you have to pay a higher premium. So if you're married and filed a joint return and you had more than $212,000 in income reported on your tax return from 2 years prior, you'd have to pay an additional $74 a month. And that would make your total premium $259. Now, Social Security actually sets your Part B premium, and they use your tax returns from 2 years prior because that's the most recent version that they have available to them. So if you receive a notice from the Social Security Administration that you're subject to this income-related premium, you can appeal it for certain reasons. So remember, it's based on the tax return from 2 years ago, which is actually your income from 3 years ago. Okay, so if you were working and you retired, you might have a significant drop in your income. So you can request an appeal to redetermine your income-related premium. And the reasons include the following 8, and 2 of them are the work stoppage and work reduction. Now, if you retire and you withdraw $100,000 from your retirement account to pay for that camper, you're likely to be faced with an income-related premium 2 years later, okay? And buying that camper is not on the list. So you need to be very careful about your withdrawals, okay? So when can you enroll in Medicare, original Medicare, Parts A and B? Okay. If you're receiving Social Security or Railroad Retirement benefits when you turn 65, you'll be automatically enrolled. Okay. If you're not receiving benefits at age 65, you have what's called an initial enrollment period. This period lasts from 3 months before your 65th birth month, the 65th birth month, and 3 months after your 65th birth month. Okay, so you have a 7-month initial enrollment period. Okay, if you're continuing to work past 65 and you have health insurance from your current employer or your spouse's current employer, you can delay enrollment and you'll have what's called a special enrollment period. Okay, and I'll talk about that a little bit more. If you miss your initial enrollment period and you don't take advantage of your special enrollment period, you have to wait for the general enrollment period, which occurs every year between January 1 and March 31st each year. Okay. So automatic enrollment. People who are receiving Social Security benefits or Railroad Retirement benefits are auto-enrolled. They'll receive an initial enrollment package 3 months before the month that they turn 65. If they happen to be disabled, they're eligible for Medicare in their 25th month of their disability benefits, and they will receive the red, white, and blue Medicare card, a welcome to Medicare package, okay? If you receive your initial enrollment package because you're on Social Security and you don't want to enroll in Part B because you have medical insurance through your spouse's employment or some other source, you can follow the directions on the back of the card and return the card and not enroll in Medicare B at the current time. And you can wait until later if you have the right kind of coverage, okay? If you're not automatically enrolled, again, you have this initial enrollment period, okay? As I mentioned, at 7 months, it begins 3 months before you turn 65, the month you turn 65, and 3 months after. You can sign up for Part A and Part B, or you can just sign up for Part A or just Part B. Some people who face that Part A premium of $585 a month won't sign up for Part A. They won't sign up for hospital insurance. So they might just sign up for Part B. Okay. You sign up for Medicare at the Social Security website, not at the Medicare website. You go to ssa.gov, and in the middle of the screen, you'll see apply for benefits. And then you click on sign up for Medicare. And that will take you to the page where you can fill out the application for Medicare. That application will ask you specifically, do you want to sign up for B now? And you can say yes or no, okay? So it's a very straightforward application, pretty easy to fill out, can be done electronically, and you'll be done, okay? If you miss this initial enrollment period or you missed your special enrollment period, you can only enroll in Part B during the general enrollment period. Now, I said that's enroll in Part B because you can enroll in Part A anytime after you turn 65. It's not really restricted. But Part B, you can only enroll during these special periods, either your initial enrollment period, your special enrollment period, or this general enrollment period. If you sign up during the general enrollment period, your coverage starts the first day of the month after you sign up. There's a penalty for Part B for late enrollment. Okay, if you were eligible for Part B for a full 12 months and didn't sign up, you would have a 10% premium penalty. Okay, and that's for every 12-month period. So if you delay 2 years, 3 years, it goes 20%, 30%. And you must pay this penalty as long as you have Part B. So it's a lifetime penalty. So you want to avoid that as best you can. Okay. So Part B enrollment, if you're still working and you have employer-sponsored insurance, you may want to delay the decision to enroll in Part B. Okay, you have coverage through your or your spouse's employer as an active employee, not retiree coverage, but an active employee that is still working, and your employer has 20 more people. Now, why would you want to not do this? If you have group medical insurance and you're employed or you're being covered by an active employee, the Medicare insurance is secondary. So it pays second. So it only pays the deductibles, co-pays, and co-insurance that your main insurance doesn't pay, right? It may not be worth $185 a month to enroll in Part B at this time. So you can delay until after you leave work or your spouse leaves work. Okay. If your employer has fewer than 20 employees, you need to sign up for Part A and B when you're first eligible. Okay. That's because if a firm has fewer than 20 employees, Medicare is the primary insurance, even if you have group health insurance through your employer. All right. So if you do not sign up for Medicare A and B, and you had to go to the doctors or something, your group insurance may not cover anything. And if it covers anything at all, it will only pay as if Medicaid paid first, Medicare paid first. So it's really important. So if you have in a small firm to sign up on time when first eligible. Also, if you're in military or retired military with TRICARE for life, you must sign up for Medicare A and B when you're first eligible. Okay, so now you're enrolled in Medicare. Congratulations. So, but there are things that are not covered by original Medicare. Prescription drugs is a big one. Long-term care is even bigger for some people. Routine dental care and dentures, vision care, cosmetic surgery, hearing aids. All right, these are things that generally you will have to pay for out of pocket unless you have some other insurance. All right. Well, here comes Medicare Part D to help cover your prescription drug coverage. Okay, it's offered by private companies. They contract with the Centers of Medicare and Medicaid. The coverage varies, including the drugs covered, co-payment amounts, and deductibles. And you're encouraged um, to compare plans prior to enrolling. And I'm going to talk about how we do that a little bit later. Okay. As new benefits for Part D, this is just recently, okay. In Part D plans, there's a $2,000 cap on your out-of-pocket costs for medications that are covered by the plan. Okay, they have to be part of the plan's what's called the formulary. It's the list of drugs that they cover. Okay, there's a $2,000 cap. So if you have some really expensive drug, let's say that it's $2,000 a month, you only have to pay $2,000 for the year for that particular drug. Okay. The new benefits, they eliminated the donut hole. People always asked about the donut hole and how they fell in it, how they came out of it, and they don't have to worry about that anymore. It's gone. Okay. There's also a new prescription payment plan. So if you have a number of prescriptions, and let's say they're going to cost you 150, but let's say it's a $2,000 prescription. Okay. And so the first month you pay $2,000, all right, and then you don't pay anything for the rest of the year, okay? But if you don't have that $2,000, there's a new payment plan that you can use to spread that cost out over the year, okay? In addition, new Part B benefit expanded no-cost coverage of vaccines. So that shingle vaccine that's not covered under the original Medicare is now covered under Part D. So to be eligible for Part D, it must be enrolled in Medicare Part A and or Part B. Okay, so you can be in one or the other or both and be eligible to join a prescription drug plan. You must live in the plan service area. So each insurer only covers certain geographic areas. And so they use your Social Security address as your Medicare address to ensure that you're in the plan service area. The number of plans that are available to you will depend on your location. Okay. You can enroll in Medicare Part D once you enroll in Medicare A or B. Okay, so if you're in your initial enrollment period around your 65th birthday, you sign up for A and B. After you sign up for A and B, you get your Medicare card, you sign up for Part D. Okay, you sign up for Part D directly with the insurance companies. Okay, if you have coverage from your employer or someone else's employer, that's credible. That means that the insurance is as good as or better than the Medicare Part D plans. You lose that coverage, you have 2 months after the month you lose coverage, or 2 months after you're notified that your current coverage is no longer credible, to sign up for Part D. Okay, so you only get 2 months after you lose this coverage. The special enrollment period for Part B is 8 months. So there's a little bit of confusion about this, and some people get caught not enrolling in Part D in time and facing a penalty. Okay. The other important thing to remember is that you can make changes to your Part D prescription drug plan every year. Okay, there's a Medicare open enrollment period, which runs from October 15th to December 7th each year. During this Medicare open enrollment period, you can add, switch, or drop your Part D coverage. Any changes you make will be effective January 1. So if you initially enroll, weren't taking any prescription drugs, and you initially enrolled in a very cheap plan that had, like a $0 or $5 premium, and then during the year you develop some chronic illness and you needed additional drugs that weren't covered under that plan, you have the opportunity to change each year between October 15th and December 7th. If you delay enrollment, as I mentioned, there is a premium penalty similar to the Part B penalty, but it's calculated very differently. This is calculated on a monthly basis. So for every month that you don't have, you haven't enrolled in Part D when you are eligible, there's a premium penalty of 1% of the base premium. So it's actually only like 37 cents a month that you delay, or $404.40 if you delay for 12 months. But it's forever. Okay, it's forever and ever. So, but if you had credible coverage, you don't have to face this late enrollment penalty. And I just want to mention that credible coverage includes those veterans that get their drugs through the Veterans Administration. So if you get your medication through Veterans Administration, you have what's considered credible coverage. And if you divide later on to enroll in Part D, you will not face a late enrollment penalty. Okay. So what do these drug plans cost? So nationally, premiums range from $0 to $125. So why so different? Well, part of it is geography. I had a person who was interested in a plan here in Virginia. It was $0 and no premium at all. I also had a relative that I was helping up in New York, and I told them about the same plan, and it was $35 a month. It's the exact same benefit plan, the exact same formula. So it varies by geography. It varies by the drugs that are covered. So some of the lower cost Part D plans are really good if you only take generic drugs, and they're not so good if you take brand name drugs. Okay. There is also a Part D income related premium. Okay, so if you have high income, you'll pay an additional income related premium for your Part D plan. Plans have a yearly deductible up to $590 a month. Some of them have no deductibles. Some of them have a $200 deductible. Some of them have a $590 deductible. Okay, you need to be very careful and look at these plans carefully. Okay, co-payments and co-insurance can vary based on the tier and the coverage phase. So, as I mentioned, there's that $2,000 cap on covered drugs. So during that period, you pay $2,000, but after that, you move into a coverage phase where you pay nothing. Okay. So the tier has to do with the formulary or the drug list. So generic drugs are generally tier 1, and then they have higher tiers, which cost you more out of pocket. Nationally, there are 7 insurance firms offering over 700 different plans. Thankfully, the number of plans available locally is much smaller and much more manageable. Okay. This chart just shows the income-related premium for Part D. So again, if you're in that $212,000, but less than $266,000, you would pay an additional $13.70 a month, and it goes up as your income goes up. And again, it's based on your tax return from 2 years prior, which is your income from 3 years prior. So as with the Part B income-related premium, you can appeal that higher income-related premium. Okay, so that takes us to Medicare Advantage. A lot of people are interested in Medicare Advantage. In fact, about half of Medicare enrollees now are in Medicare Advantage plans. Okay. Medicare Advantage plans include all the benefits and services covered under Medicare Part A and Part B. They're covered, they're run by private insurance companies that follow the rules set by Medicare. They usually include a prescription drug plan as part of the plan. And this is really important to think about. If you have credible coverage elsewhere, so let's say you have VA benefits, you can pick a Medicare Advantage plan that doesn't have a Part D plan. Okay. But if you don't have other credible coverage, you really need to sign up for a prescription drug plan within the Medicare Advantage plan, right? Because you can't sign up for a plan, a Part D plan, outside of that Medicare Advantage plan. Okay. All right. So, and Medicare Advantage plans usually include extra benefits and services that aren't covered by original Medicare. Okay. Medicare Advantage plans include HMOs, think Kaiser Permanente as an example, or preferred providers organizations, which have generally a broader network and allow you to see a broader range of providers. Okay. Nationally, there's 34 options from 8 insurers for Medicare Advantage plans to choose from. Okay. Again, locally, that number may be smaller. In some geographic areas, there are no Medicare Advantage plans. All right. But again, they're very popular in Florida. About 75% of enrollees are in Medicare Advantage. In our area, in the District of Columbia area, about 25% are in Medicare Advantage plans. You find Part C plan using the Medicare Plan Finder. I'm going to talk about that some more in a minute. Okay. To be eligible for Medicare Advantage, you must live in a plan service area. Again, it's that Social Security address. All right. So if you have a Social Security address in Virginia, but you spend a lot of time, more than half the year in Florida, there's a problem with signing up for Medicare Advantage plan. Okay, you must have A and B. And you can also enroll now in a Medicare Advantage plan if you have end-stage renal disease. What do Medicare Advantage plans cost? Most, you still have to pay the Part B premium. Okay, so that $185 a month, you still have to pay in order to enroll in a Medicare Advantage plan. You may also have to pay a monthly premium to the plan. Some are zero, but the range nationally is from $0 to $134. Why again? Many plans, it depends on the drug coverage within that plan and their formularies and their tiering, just like we talked about when we talked about Part D. Okay? So you can look at these plans and you can pick a zero premium plan, or you pick one that's a little bit higher tier if you need coverage. Many offer a reduction in Part B premium. So that $185 a month, they may offer a rebate of $50 or $75 a month. So it kind of reduces your premium costs, right? With Medicare Advantage plans, you pay deductibles, co-insurance, and co-payments that differ from original Medicare. So when I mentioned Part A hospital insurance, where you had to pay the deductible of $1,600 when you entered the hospital, Medicare Advantage plans will charge you a deductible per day. So they'll say, well, there's not a deductible, but there's a copayment. So you have to pay $235 a day for the first 5 days, and then you pay nothing. Okay, so it's different from original Medicare. It varies from plan to plan. And the cost for your deductible, and not your deductibles, but your co-insurance and co-payments could be higher if you go to an out-of-network provider. Okay. These plans work by you remain in Medicare, you still get Medicare benefits. They may include drug coverage. They may include extra benefits like vision, dental, and hearing. Almost all the Medicare Advantage plans offer these 3 benefits at some level. It's really important to carefully review the plan document to see how much dental coverage there really is, or how much hearing coverage there really is, and whether it's worth entering that plan because of that. Right. The plan documents lay this out very clearly. Some plans offer a minimal dental plan, but then they offer a supplemental dental plan where you can pay an extra premium to have a better dental plan. Okay. Again, costs may be higher if you go out of network. Medicare Advantage plans often require you to have a referral from your primary physician to see a specialist. Okay. And again, benefits and cost sharing may be different. Okay, whereas, Medicare Part B, you're liable for 20% of the charges. In Medicare Advantage plan, you may have a copay of $25 or $50 or whatever for each visit. Okay. When can you join or switch your Medicare Advantage plan? Okay, when your initial enrollment period, you again have the opportunity to enroll in a Medicare Advantage plans. So in your IEP, your initial enrollment period, you sign up for A and B. Once you sign up for A and B, you can enroll in a Medicare Advantage plan. Okay, so that's your initial enrollment period. Medicare Advantage also has an open enrollment period every year. Okay, it's called Medicare Advantage Open Enrollment Period. It runs from October 15th to December 7th. Okay, there's also a special enrollment period that you might be eligible for. If you move out of the plan service area, so let's say you live in Arkansas and you move to Wisconsin, that Medicare Advantage plan you were in Arkansas is not going to cover you in Wisconsin. You need a new one, and you'll get a special enrollment period in order to do that. If you lose your employer coverage, you also get a special enrollment period, again, to sign up. There's also another enrollment period called the Medicare Advantage Open Enrollment Period. This runs every year from January 1 to March 31st. If you're currently enrolled in an MA plan, a Medicare Advantage plan, you can change plans during this period, or you can switch from a Medicare Advantage plan back to original Medicare. Okay. You can't go from original Medicare to a Medicare Advantage plan. You can only do that during Medicare's open enrollment period back in October. Okay. Now, I often tell people that switching plans is somewhat desirable if your providers, your physicians, are no longer participating in the particular plan that you're enrolled in. You have this opportunity to change. So it's very important to keep that in mind. All right. Important items to consider when choosing between original Medicare and Medicare Advantage. Okay. One is provider access. Medicare Advantage plans often require that you see in-network providers. And if your favorite doctors or providers are not in-network, it could be more costly for you. They require specialist referrals. Out-of-pocket costs differ, but coverage of services differ, coverage of foreign travel. Medicare Advantage plans are not Medigap. In fact, you cannot have a Medicare Advantage plans and a Medigap plan. These next two charts cover what I've just talked about very briefly in more detail, and I believe you'll get the slide deck and you'll be able to look at that. Okay, I just mentioned Medigap. Okay, remember that original Medicare doesn't pay all the costs. There are deductibles, there are copays, etc. So Medigap tries to fill that gap. It's called Medicare Supplement Insurance, not Medicare Advantage. Medicare Supplement Insurance. Okay, Medigap policies, again, are run by private health insurance companies for individuals. They supplement original Medicare coverage. They follow state and local laws. Okay, now they supplement original Medicare coverage in the sense that they pay the deductibles, the copays, and the coinsurance for Medicare-approved services. They don't cover things generally not covered by Medicare. The exception is foreign travel. Okay. Medicare Advantage, Medicare Gap plans, some of them will cover some foreign travel. Okay. You sign up for a Medigap plan. The best time is in your initial period, which is your guaranteed issue period. Okay. The guaranteed issue period starts when you're 65 and you sign up for parts A and B. Now, if you delay part B because you're employed, okay, and you don't sign up for part B until you're 70, your guaranteed issue period starts then, okay? It only lasts for 6 months. Once started, it can't be delayed or repeated, okay? This period is really important because basically what the guaranteed issue says is that the Medigap provider, the insurer, cannot deny you insurance if you have any medical conditions. So if you have chronic conditions, you take a boatload of prescriptions, during this period, they cannot deny you coverage and they can't make you pay a higher premium. If you miss your guaranteed issue period and you try to enroll a year, 2 years later, they can they subject you to medical underwriting and they get your medications and your medical history, and they can deny you coverage or they can charge you a much higher premium. Okay. So with Medigap, you pay a monthly premium directly to the insurer. The costs vary by plan, company, and location. Okay. Medigap insurance can only sell standardized Medigap policies. Medigap does not work with Medicare Advantage. It's really important to remember that. Okay. There are 10 standardized plans that have varied benefits. There's a publication that the Centers for Medicare and Medicaid send out to Medicare eligible people called Medicare and You. And there's a chart on page 76, which lays out the different standardized plans and what they cover or how much they cover. I also included the chart at the end of this presentation. All right, so I've talked a lot about Part D, Medicare Advantage, and Medigap plans, and how, and you should sign up for them and when. But how do you do it? All right, so anyway, well, the way you do this, the way you find plan options is to go to medicare.gov/plan-compare. All right, this is a tool that the federal government put together, which allows you to explore options in your geographic area that are available to you. Okay. I often recommend that people create a Medicare account to save any information that you enter. Okay, so if you're looking at Part D drug plans, you need to enter all your prescriptions. And if you have a Medicare account, it saves those prescriptions in your account. Not only that, but if you get new prescriptions during the year that are covered under the Part D plan, they get added. So this is very useful if you need to go back to explore other options of Part D plans or MA plans. All right. So it's really important to enter your medications to ensure that the plan covers those medications and what the costs will be. If you're looking at Medicare Advantage plans, you need to verify that your providers are in network. Okay. To search for plan options, you can call the insurer directly, or you can contact your local SHIP to get coverage and premium verifications. All right. Here's a screenshot of medicare.gov/plan-compare. Okay. This is the second page. The first page just asks you for your zip code so that you have your geography. All right. But now you can explore the options available to you for a Medicare Advantage, Part C, a drug plan, or a Medigap policy. And you say find plans, and then it will say, if you're looking at a Part D plan, it will say, do you want to add your drugs? And you want to say yes. You add all your drugs, then you add your pharmacies, all right? And you make sure that your pharmacies are in network, all right? And then it'll show you the available plans for you and how much they cost and what the premium is and what the drug costs are. So let's just recap here. Original Medicare has two parts: Part A, hospital insurance; Part B, medical insurance. Original Medicare doesn't cover 100% of healthcare costs and doesn't cover some important services like dental, hearing, and vision, or prescription drugs. So you want to add a prescription drug plan, Part D. You might want to consider enrolling in a Medicare Advantage plan. If you don't, you may want to consider adding a Medicare supplement plan to help cover the Part A deductible copays and coinsurance. Next up, retirement ahead. Okay. So let's say that you turn 65 and you're still employed and you're going to work till 70, 75 and on. Okay. And you have employer group health insurance. You're not going to sign up for Part B. You'll probably sign up for Part A, all right, because it's free. And you should do that when you turn 65 in that initial enrollment period. But you may skip B for a while because you don't want to pay that $185 a month for very little benefit. All right. But when your employment ends, okay, you're getting to retire, you have 8 months to sign up for Part B without penalty. Okay. But as I mentioned, when I talked about Part D, you only have 2 months after that employer insurance ends. Okay. You sign up for Part B at ssa.gov using form CMS 40B. And you'll also need to include another form, CMS Else 564, which requests employment information. And this verifies that you've had group health insurance up until the point that you retired. And therefore, you will not be subject to a penalty for either Part B or Part D. Okay.
Don, I just wanted to share it's 12:53.
Oh my gosh. Okay.
That are skipping over some.
Thank you. All right. So again, you find a Part D plan or a Medicare Advantage plan through your medicare.gov. Your employer may offer COBRA coverage, and special rules apply. COBRA is a program that allows you to continue your employer coverage after you leave work. Depending on your employer, you may be responsible for the full premium of this insurance, and it could be very expensive. Okay. COBRA is not insurance from current work, and therefore COBRA is secondary to Medicare. All right. So if you don't have your Medicare, you haven't signed up, and Medicare is, and COBRA is secondary, they may only pay a small part of the bill. Okay. COBRA doesn't qualify someone for a Part B special enrollment period. And while it may provide credible drug coverage so you can delay Part D, okay, someone with COBRA should enroll in Medicare B within 8 months of losing their active employer insurance. Okay, if you don't enroll within 8 months, you may have to pay a premium. Okay, health insurance employers provide those who are retired. Federal, state, and local governments, as well as school districts, offer retiree coverage. Many large firms and few large firms and fewer small firms offer this. There's also a growing reliance on group Medicare Advantage plans. Okay. Retirees that offer Medicare Advantage exclusively are unable to choose a traditional Medicare unless they withdraw from their retiree health benefits. These group health Medicare Advantage plans differ in important ways, and they're really quite generous, and they're really worth looking into if they're offered. They have lower and no deductibles, they have lower copays, they have lower out-of-pocket maximums, they generally cover in and out of network care, they have national networks, and they have more generous drug coverage. Okay. Many retiree plans require that you sign up for Parts A and B to have full coverage. Okay. Although Medicare is primary, it may be beneficial to keep your retiree coverage because it can act as a secondary coverage similar to Medigap. It may provide you with credible drug coverage so you don't have to sign up for Part D. Okay. And it may cover some things that Medicare doesn't. I advise you to check with your health specialist in the HR department of your employer. Okay. In retirement, Medicare is the primary payer. That means it pays first. Your retiree plan works as a Medigap plan. Your retiree plan may pay those deductibles, copays, and coinsurance that Medicare does not, and it may cover services that Medicare does not. State, local, and school retirees, again, many jurisdictions have moved to these group plans, Medicare Advantage plans. You need to be signed up for A and B. If you decline this coverage, you may not be able to get it back. There's often no option to suspend coverage, to go to original Medicare or do something else. Okay. Some Medicare Advantage plans are offered without drug coverage. Be careful because you cannot sign up for a Part D plan if you're in a Medicare Advantage plan that doesn't have it. Okay. Each jurisdiction, again, has a health specialist. Seek them out. If you enroll in B, watch for that IRMA letter and be prepared to appeal. After retirement, you lose premium conversion, which allowed you to pay premium with pre-tax dollars. So actually your premium goes up in a post-tax world. At retirement, you're no longer eligible or able to access your flexible spending account. Really importantly is if you had a high deductible plan and a health savings account, you can no longer contribute to that health savings account. Okay, you'll be subject to an IRS penalty if you continue to contribute to your health savings account after you enroll in Medicare. If you have a younger spouse or minor dependents, you need to consider things very carefully. And again, I advise you to talk to a SHIP counselor. So takeaways and checklists. Enroll in the right time. Permanent financial penalties may apply. Research your options. Understand the differences between original Medicare and enrolling in private, individual, or group Medicare Advantage plans. Consider programs that help you reduce your out-of-pocket Medicare expenses and understand your right to change coverage if you need to. All right. Again, contact your local SHIP. The number and the website are there to help you find the local SHIP program that can provide you with counseling. Okay. These next slides are just a series of resources, different publication sources and forums that you might need. This is that Medicare U handbook I mentioned. These are the Medigap plan options that we talked about a little bit. If you happen to be a federal employee, a great guide is this Washington Checkbook Guide to Health Plans that's issued every year. Preventative services, I mentioned this. This is an important document for you to look at. Okay. I want to thank you for joining us. I'm sorry if I went over. I tend to talk too much.
Well, this is a very difficult topic to cover in in an hour or a short period of time. But thank you, Don. And Michelle, I think you did a great job. And I wanted to just jump on to let folks know that Don and Michelle can hang on a little bit longer here, and maybe what we can do is go through some of the remaining questions. Michelle, you've been typing frantically there, responding to lots of questions in the Q&A, folks. You can see Michelle's answers, but I just want to remind everybody this is recorded. It'll be at proaging.com this afternoon. Michelle and Don, you'll send me the PowerPoint and I can put that up there on the recording link, along with all the chat, along with some other handy resources. But with that, let's, Michelle, do you have any of the outstanding questions that you thought that we should address? Or I see that there's 3 or 4 that are in the queue that you
Yeah.
haven't typed an answer.
Yes. Yeah, there's so many questions, but there's some questions here. Let's go to the federal retiree questions and focus on those. So here's one. It says, I'm a federal worker retiring on July 31st, 2025, age 66. My husband and I have Part A with FEHB, Blue Cross Blue Shield. When should we sign up for Part B, as in boy? And this is a hot question. I think there's a couple questions in the same topic. So Don, do you want to address that?
Sure. So as you're approaching retirement, you can sign up for Part B. I usually advise people who are signing up for Part B to fill out the application several months before they retire, so that their Part B insurance will be effective when they retire. Now, on the Part B application, there is no place to put a start date. Don't ask me why, but there's no place to put a start date. But there is a comment section or an instruction section, and in there you'd say, I'm applying now, but I want it to start July 1. All right. And they'll honor that. Okay. Now, as a federal retiree, you have the option of not enrolling in Part B, and that's a financial decision versus a health risk decision. And that's a lot more that I could go into right here. I spend a lot of time with people. I counsel a lot of federal retirees or federal retirees that are looking to retire, federal employees who are looking to retire. And it's one of the few groups that have this option of not taking B and keeping their FEHB health insurance, and having that be the primary for their providers. So, yeah, if you're going to sign up for B, I would advise you to submit your application several months before your retirement date and put on the application when you want it to start. Okay, again, you go to ssa.gov, apply for Medicare, you scroll down, there'll be a place that says enroll in Medicare B only, and you can fill out the application. And then you have to have your HR department submit this other form that attests that you've had group health insurance while you're employed.
Yeah, the link is in the slide deck. So
Yeah,
once that's
right.
shared, you guys will have it. There are and I know I answered some questions in the Q&A, but here's another one regarding Medicare and the coverage of long-term care services. So let's talk a little bit about Part A, Don. And it says, does Medicare cover long-term care services at the nursing home? And if it does, for how long?
So Medicare does not cover long-term care. It covers
That was on the slide deck.
SNF care.
Right.
So if you're in, let's say you're in a nursing home because you need medical help with something that you were just in the hospital for. So you broke your hip and you went through rehab and it's not working. And so you go to this residence, but long-term care is not covered by Medicare, unfortunately. There was a movement to try to do it back 10 years ago, but in fact, it was so expensive for the federal government that it just didn't go anywhere. Sorry. No long-term care coverage.
Thank you, Don. The next one, sticking with retirees, if covered under spouse's health insurance policy, do I need to provide proof of coverage to SSA in order to temporarily opt out of Part B and avoid a future penalty? I will sign up for Part A when turning 65.
So if I understand this correctly, you're not 65 yet. When you turn 65, you're going to enroll in Part A only. So when you fill out that application online and it asks you whether you want to sign up for B now, say no. And it'll ask you if you're covered by an employer group policy. And you say yes, because you're covered by your spouse's employment policy. That allows you to delay enrollment in Part B until your spouse loses her health insurance, either through work stoppage or retirement. Does that make sense?
I think that was Tom's question. So let's see. Here's a question about TRICARE. I know that wasn't part of today, but maybe we can quickly answer that. It says, can you have TRICARE and not be required to sign up for Medicare at 65?
The answer is no. If you have TRICARE, you're required to enroll in A and B when you're first eligible. And they work together seamlessly to provide your health coverage.
And then understanding, so I'll see if I can quickly find a resource because sometimes people get TRICARE and TRICARE for Life confused, but we won't go into that right now.
Right.
Yeah. Let's see. I'm looking specifically for Medicare and retirement since that's kind of the focus for today. So Amy, did we answer your question? Was that question answered from Amy? Steve, is she able to come off of mute or?
Yeah, no, we did. Everybody just, oh, she says no.
Yeah, she said no.
But
Okay.
Amy, what I'd maybe recommend, uh, is it okay if I share either your email or Don's email and
Yeah.
maybe, okay,
Yeah.
let me share Don's email. Um, and Amy, I would recommend, reach out to Don uh and hopefully we can get you to an answer that works. Okay. All right. Uh yeah, let's see. We've got I know Michelle, you've got a hard stop at 1:15 Eastern time. Do you want to pick another question or two and then folks, I'll make sure that we have all this info at proaging.com under the recording links.
Yes, we'll do. And just because there are a few questions in here about TRICARE, which we won't get into today, but I will find a resource that can be shared for Medicare and TRICARE, and then encourage people to contact your local SHIP office, and they can provide like detailed counseling about that.
Okay, great.
Part B, we're getting a thank you. Let's see if I can find one more.
Okay, and I'm dropping Don's email into chat there, but it'll also be on the link.
Okay. Denise, and this is our Denise, going back to part A, does any part of Medicare cover in-home care services, non-medical, non-skilled? This would be for one-on-one care services, help in the home. So we can talk about being medically necessary. I think Denise, did I answer your question? Did you also put this question in the Q&A
I
as well?
think she
And in
I
the
think she
chat?
might have put it in Q. Denise has a couple of questions there. Thank you. Yes, it looks like non-medical is covered as long as skilled nursing is also being received.
Okay.
Yeah.
And let's see. She does say the link does not say how many hours can be provided for non-medical home care needs. How can I find this information?
So that's a discussion. If your doctor deems it medically necessary, that the doctor would authorize the amount of time that can be provided.
Okay. And then, all right. Let's see. Okay. Well, I think let's see here. I think we did a good job here for an hour and 10 minutes. It's but this clearly is a topic that we need to explore on a regular basis. So let's schedule another one of these, and we can address more questions.
Okay, thank you so much, Steve. Appreciate the opportunity to join you guys today.
Thank
Yeah.
you. Thank you, Steve. Thank you for everybody hanging in there.
Yeah.
Yep. Yeah. Great job. And I'll work on getting this up as quickly as I can.
Okay.
All
Thank
right.
you.
Bye.
Thanks,
Bye.
everybody.
Everyone.